Welcome, everyone. If we can, I can't see myself, but I'd like to, if you can hear me, welcome. Yeah, there we are. Welcome everyone to this to the 6th episode of the Bedrocan Series with a very special guest today, Dr. Albert Batalla from the University Medical Center of Utrecht. During this session, we have about half an hour. This is the interactive session. The webinar will also be posted online, but if you have questions, you need to be there right now. We have, you can click on Q&A if you have any questions during the session for Albert or for me or anything else. You can use the Q&A session. I'll try to use those questions during our conversation. And if in the end any questions are left, we'll see if there's any time left. Albert, are you there? I can see your picture.
Yes.
Yes, there you are. Welcome. So,
yeah, thank you.
You are a psychiatrist as I said, you're a psychiatrist at the Utrecht University Medical Center, and you have a lot of knowledge on addiction. Before we dive into the topic today, can you please tell us something about your background?
Yeah, sure, I'll be happy to. Well, first of all, thanks for the invitation. Really nice that I can be here and share thoughts with you about the use of cannabis as a medicine. So yeah, my name is Albert. I'm a psychiatrist and I'm currently working at the University Medical Center Utrecht. But if you want to know a little bit about my story, I'm originally from Spain. So I actually grew up in Barcelona, and where I studied and graduated there as MD, medical doctor, and later as specialist in psychiatry, also in Barcelona in hospital clinic. It's a academic hospital in the center of the city. And I performed there also my PhD on the effects of cannabis use on brain, particularly on brain structure, but also a bit of functional. And also, of course, its relation to psychotic disorders. And after that, when I finished my PhD, that was in 2014, then I moved to the Netherlands. And I worked first in the addiction care here in the Netherlands, and after that I moved again to the academy. And in the last 3 years I've been working in this hospital at the UMC Utrecht, where I I do two things. I perform here clinical tasks, but also some research tasks, and I do this within a health program that I developed and set up last year. And this program is named, translation would be something like care program, substance use and psychiatry. And in this program, what I do is actually to treat people with all kinds of psychiatric complaints. A lot of psychotic disorders is what I'm seeing, but not only, and also comorbid addiction. So I'm seeing people who have psychiatric complaints and also addiction, and I try to help them to stop using drugs and improve to the psychiatric symptoms. And in my research, I'm particularly interested in cannabis compounds and products, because I know that these products maybe some might enhance the current treatments that we have for addiction and for psychiatry, and that's what I do.
So you in the University Medical Center, you run a normal psychiatry practice and focusing mainly on people with addictions also. Yeah, and is it only drug addictions, or can it also be gambling and other stuff?
Yeah, that's a good point. I'm not that specialized in gambling, so my focus is a substance use.
Substance use.
Not behavioral addiction, but substance use addictions. Yeah.
Yeah, and that's so it's not limited to cannabis. It can be any substance.
Yeah, exactly. Yeah. I help people also who want to stop smoking, alcohol use disorders, cocaine, heroin, whatever, cannabis, of course.
And you're in our meeting. Of course, you work with medicinal cannabis. You have people come to you with for specific reasons. Can you tell us a bit about that?
Yeah. There will happen something interesting, because I do some research in cannabis, and then I notice in the last months, particularly, that I have got a lot of questions, a lot of patients who came to me asking really, really important and relevant questions of whether they were eligible for using medicinal cannabis because of different psychiatric complaints. And I was a bit surprised about this, actually. And what I noticed is all of these patients that they found me because of Google, right? Like going on a website and seeing that I was doing research in in cannabis, and then they came to me with this question, and all of them were already for a long time looking for answers. And what I noticed is that most of these patients, they were rejected, or sometimes not really taken seriously by all the psychiatrists or GPs, and they had these questions, right? Because I have a certain complaint of certain problems, and I noticed I improve if I use cannabis. So I like to talk about a possibility of using medicinal cannabis, and they were most of the time rejected. And that's why I decided a couple of months ago to open this outpatient unit, just to try to provide reliable information about these important questions.
Okay, so it's patients, and are it then patients that are interested in using medicinal cannabis or getting it prescribed, or patients that are already using it and have questions about that?
Yeah, that's a good point. Actually, all the patients that I've seen until now are already using cannabis from a coffee shop. Well, here in the Netherlands, I don't know if there are public outside the Netherlands, but here in the Netherlands, you can buy cannabis in coffee shops. So all the patients, they were buying cannabis in the coffee shops, and they were suffering from stigma because they don't really wanted to buy the cannabis in the coffee shop. So they came to me with a question, would it be possible to get regular cannabis, to get a prescription for cannabis? And that's a question. And of course, what I do then is, first of all, take this seriously and take the time to provide a grounded answer of why it is or not a good idea to use cannabis for a certain complaint in a certain context.
Okay, so we're talking about patients that have a psychiatric disorder somehow, or already using cannabis but sourcing it not from a doctor but from somewhere else, and then they come to you. What kind of patients are we talking about? What kind of disorders are you seeing?
Yeah, well, I'm actually a lot of different things. So I cannot say that I have kind of a type of patients. I've seen patients with ADHD. I've seen patients with personality disorders. I've got also questions from patients with psychosis. Even I've also seen patients with autism. So really a range of different disorders, and also really different complaints, right? Because some were having problems with, for example, negative thoughts. Other people were complaining about having hypersensitivity or suffering from overstimulation, or different complaints within these different psychiatric disorders. Yeah.
Okay. So but they are all somehow using cannabis to treat themselves.
Yes, yeah, exactly. So that's what they are doing, and then they come to me with a question if it's a good idea or not. Just to be clear, maybe a short disclaimer. There are right now no approved indications for the use of medicinal cannabis in psychiatry, right? So here in the Netherlands, maybe for the public, it's good to know. So here in the Netherlands, you can't prescribe cannabis since I think 2003, but there are right now no indications in psychiatry. So that means that if you as a doctor would like to prescribe cannabis for psychiatric conditions, you have to do these in what we name off-label, right? So it's not, there are not approved indications for the use of medicinal cannabis right now. And that's because the evidence that we have until now is not enough to show that cannabis help for a certain diagnosis of a certain indications, because the research that we have done until now is not enough to be conclusive. So we need more research to see if there's possible benefits in using cannabis for certain psychiatric conditions.
So these patients come to you, and many of them are already using cannabis, but it doesn't mean that you will be prescribing it to them as well. It can mean that you would say use something else.
Yeah, exactly. Yeah. Of course. Actually, what I noticed as well is that so most of the people that I saw, they were not really only like looking forward to get the prescription. They had actually a lot of questions, and they were looking also to find someone who wanted to take the time to talk about this topic and get a grounded response, a grounded answer about the problems that they have, and that's true. So most of the time, what I saw is that most of the complaints that the patients had, there were approved treatments that the patients hadn't done yet. So of course, before you are eligible to use medicinal cannabis or other off-label medication, you have to go through the standard treatment. So that's always the first step. And what I saw in a lot of the patients that I've seen is that most of them already they had still to go through the regular treatment. So that's why most of them didn't get a prescription from me.
No. So actually, to most patients in your medicinal cannabis clinic, you do not prescribe medicinal cannabis.
Yeah, exactly.
Because
I did, and I have some, but of course, most of them there is no indication, there is no reason, because it's always, you have to weight the drawbacks, the positive effects. Of course, is something that you have to do as a clinician, and also the patient also has to think about this, which are the drawbacks, which are the positive effects, and then make a decision.
And you got so many questions actually that you decided to open a special outpatient clinic inside the University Medical Center. How did that go about?
Yes, well, that's what I said, because I just noticed, I was also a bit surprised, because it was like in 6 months time last year, I got like 6 or 7 patients asking questions about medicinal cannabis. And then I was like, oh, wow, what's happening here? And these people were just missing a place or someone, this space to talk about this in a safe way, without shame and without stigma and judgment. And that's what they were looking for. And they were actually really happy to find this space. And when I saw that, these old patients, I told here to my bosses, and I said, well, I noted this in my polyclinic. So would it be okay if I just, provide this space for the patients who wants to know more about medicinal cannabis and the relation with psychiatry? And they were happy with that. And that's why we decided to open this polyclinic.
Okay, so actually a problem is that many of these patients, they come to you because your colleagues throughout the country, they don't really take their problems seriously.
Yeah, that's what some of them told me. I don't know, because I didn't go with this question to other colleagues, but I can imagine, because that's something that we know, that the knowledge in general about medicinal cannabis is really low in psychiatrists, but also in GP. So I can imagine that some will feel like overwhelmed if they get questions they don't have really an answer for.
And many of these patients that come to you are already sourcing their cannabis from a coffee shop. And of course, if a doctor prescribes, you will get medicinal cannabis. Can you tell us a little bit what is the difference between the two, and why is it important to take it through a doctor, or at least get doctor's advice?
Yeah, that's a good point, and it's also where the patients are asking for it. So the patients, what I noticed in the people that I've talked to is that they don't want to go to the coffee shop because there's a lot of stigma. So if they think, well, I have a condition and I'm using this as a medication, I would like to go in the regular circuit. I don't want to go to a coffee shop to get this medication. But of course, the first step is thinking if there is an indication for this medical cannabis. Of course, so the first step. But that's an important point. It's not about the money, and it's not about, because here in the Netherlands you have to pay for the prescribed cannabis, right? And it's approximately has the same price than in the coffee shops. It's not that people want to go through me or through doctors to get a medicinal cannabis because it's cheaper, but just because they don't want to, feel the stigma of having to go to a coffee shop. And of course, and also more importantly, even, is that the cannabis that you get from coffee shops or whatever, so outside the regular circuit, you don't really know what you were using. Because they don't have quality controls, they don't have, kind of follow-up monitoring. What are the consequences, the positive effects or the negative effects over the time? There's no agreement in how do you have to use this, which doses should you use, etc. So it's actually pretty dangerous of doing this yourself with a product that you don't know what's actually containing.
So having negative side effects is one of the reasons to go to a doctor and then get doctor's advice. Can you share a bit what are the negative side effects you experience with your patients? Yeah,
well, that's also an important thing because there's not that much that we know about that, because here's happens something really interesting, that all the information that we know about the side effects of the negative effects of the cannabis come from the studies which study recreational users, right? So we do not have that many studies showing which are the side effects of the negative outcomes when cannabis is used as a medicine. And using cannabis in a recreative way or recreational way and in a medical way, this is totally different, of course, and probably the risks are different. So what we know about the side effects of cannabis comes from the studies from the recreational users, and from there we know that cannabis may have really clear negative effects, and the range is also really it's pretty big. So one, for example, is addiction. That's something that I do in my clinical practice because I see patients with cannabis addiction and I help them to stop using cannabis. So that's one of the consequences of using cannabis, or might be one of the consequences of developing an addiction. Another one, for example, is the risk of psychosis. That's also a possibility that may happen. Well, and there are several, but what I wanted to talk to you is that what we see is all the information that we have come from the recreational use and not really from studies from patients using cannabis in a medical way. So that might be a difference. And what we see also, what we know is that the negative effects and the side effects are often related to the composition of the cannabis. So the more THC the cannabis has, the more the chances that you will get negative effects from it. So that's something that we also know. And the more time that you're exposed to is the more the chance that you have to develop problems with cannabis.
So recent data from the Netherlands, and I think it's comparable to many other countries, recent data showed that over 90% of people using cannabis for medical for medical reasons do not consult a doctor and just do it on their own. How do you feel about that?
Yeah, well, this is pretty worrisome, I would say, because what I said, cannabis from unknown suppliers is not really reliable in terms of composition, doses, quality. So I would say it's not a good idea. And in any case, self-medicate yourself without supervision, without a medical context, is not a good idea, because then you get more chances of having negative effects from the cannabis. So it's something that I wouldn't advise. And I would say that it would be important to take these people seriously and maybe make an evaluation if they are eligible for using medical cannabis. This said, I'm not saying, once again, that all people who think that they should use cannabis, that they have an indication for using cannabis. That's also something really important, that you feel better or improve certain symptoms in the short term. That doesn't mean that you may have a lot of trouble in the long term, right? So that's the difference. So the short-term perception might be really different from the risk and the things that you have to wait for the long term, right? But you have to take this seriously. So you have to talk to these people and evaluate which are psychiatric complaints, how long have these complaints been present, what's the relation with the cannabis that they're using, are there other drugs, are there signs of addiction, etc., history, listen to the whole story, and then weigh the risks and the benefits as a clinician and also as patient, and then make a decision. That's why we do in our clinic. So I would say that these people they would need to be carefully assessed.
Yeah, and would you say, because we also know that a lot of patients, doctors who are not familiar with the product, if a patient comes to them with questions about cannabis, they often say, well, try and get some at the coffee shop and see what it does. Would you say that educating your colleagues would be one of your tasks as well?
Yeah, that's an important thing. Yeah. I also noticed that. So most of psychiatrists, and I understand, because psychiatry and medicine, of course, is a really huge field. I mean, you can't super specialize in all kind of things, and the knowledge and in cannabis products is really low in general in the medical world. So I think, it would be, well, maybe my task, but also others, because I'm sure I'm not the only one doing this in the Netherlands. I do not know other colleagues, but I'm totally sure that there are other people experiencing the same that I'm experiencing. And yes, we have, as clinicians, we have a duty to, provide reliable information. And if a patient has a question, just to provide a grounded answer. So I would say, yes, we have to better inform and teach also our colleagues about the use of medical cannabis for certain complaints. Yeah.
and you also mentioned the stigma that patients experience when they go to a coffee shop. Would you say that the type of administration method, is it the same if they use tea or smoke it or use it as an oil? Does it contribute to the amount of stigma?
Yeah, I would say it does. In the patients that I've seen here, when they got cannabis from the coffee shop, that they also had different ways of using. Some vaporizing, but a lot of them also smoking. But of course, smoking is something that we will not recommend. That we would not recommend at all. So the ways that we advise to use the medicinal cannabis is or vaporizing or using it as a tea, as an oil, so it's our oral solution. So that's the way of using it, and not smoking, because we know that the side effects of the negative effects of smoking are much are really worse. So, and most of the patients that I had, yes, they were suffering stigma, and most of them were smoking, but a lot were willing to change, and some of them were already using certified vaporizers, and really taking care of their own healthy, so of their own health. So that was also nice to see.
So that's actually one of the first things you do when patients who are already using cannabis come to you, stop smoking it and try a different method.
Yeah, sure. And anyway, and even though if I see, for example, that also happens sometimes, that I do not see an indication, I may say, well, using cannabis is really a bad idea, because I can imagine that this, is not helping you in the short term, but not in the long term, for example. But the person has another means. Sometimes you have to try to, reduce harm sometimes, right? If someone has really trouble decreasing and stopping using the cannabis, you can also advise him to use a cannabis at least that is not, or is providing the less damage as possible. That's also a possibility. And of course, not smoking is something that we advise regularly, because also a lot of people who smoke cannabis also mix it with tobacco, and that's of course a bad idea for a lot of other reasons. So.
Let me go to the questions. I have a question from Linda, but that's actually off topic, so I'd like to do that in the end. I don't know who's asking the question. It's an anonymous attendee, but you set up your clinic. I think it's open since December. What would you like to achieve with your clinic? What's your goal in the next couple of years?
Yeah, that's a good thing. Well, what I want to achieve, so the first time, is just providing a place for people who just want to talk, freely about the use of cannabis as medicine, so that they have a place where they can get reliable information about it. So that's another one. And actually, for the future, I do not have any ambition. So what I would like to see is that my clinic disappears, because that would mean that everyone is just getting the right information everywhere. So that's what I would like to see, because that's something also really interesting, because we are talking here about using cannabis as a medical use of cannabis, but that's something not that really new. So there are already other drugs of abuse that has been used for years in medicine. So that's something relatively new, right? And there are a lot of examples. So it's a bit of the same, but just in a field that's still not that much knowledge. So that's something that we have to improve in the next year. And I have the idea that if we perform enough research and the knowledge is good enough everywhere, my clinic would not be needed anymore. That would be the best scenario. And
are you enrolled in any particular research at this moment on the topic?
Yes, there are some studies that we will perform here at the hospital in the next years, and these are several. These are really different kind of studies, because that's also maybe important to mention. The cannabis, it seems like it is a medicine, but you could also say that cannabis is more kind of family of medicines, right? Because you have you can have a lot of different compositions. You can also, for example, use CBD alone, and that's totally different from other compounds. So that's complex things. And here in the hospital, we will perform trials with CBD, and also we would like to study the safety of medical cannabis in healthy volunteers. That's something that also we'd like to do in the next time.
Another question, because you work at a University Medical Center. Normally, you can't just walk in there. You need a transfer, how do you call it, recommendation from your GP. How about your outpatient clinic? Can anyone just walk in, or how does it work?
Yes, that's a good point. Well, the only thing you need is that's true. So you need that your GP writes a report and asking us to for a consult with me. So that's the only thing you need. Yeah, you cannot just walk in, but you can just ask your GP to refer to us. Okay.
So in Dutch terms, you are a second line of healthcare.
Yeah.
And how do you? That's an interesting one. How do GPs know about your existence?
That's a good point. they don't know, because some GPs that call me sometimes because they just Google me and then they found me and oh look, this guy is doing things with cannabis, so I'll call him. So that's the way. So we have a website also here in the hospital, but of course, that's really complicated to get the big public. So this is also a way to get us to know to the rest. But that's a really good question. So they do not find me.
So there's also some work to be done to know about that you exist. It's important. Last question on topic I have here is, you talked about your bosses who thought it was a great idea and you didn't experience any negative reactions. How about the rest of your colleagues? How do they respond?
They respond very well as well. So they are actually really happy that someone is doing this, because it's something that you see it in academia, but also in other institutions, that the knowledge of substance use in general is not that high. So in general, people are really happy when there's someone like having a bit of knowledge in that topics, because unfortunately, there's something that not all psychiatrists are really happy with, and that's important. And I think that's related because to the fact that the relation of the substance use and psychiatry is actually pretty complicated, right? So you see this double effect here, because at the one side, we know that cannabis use, for example, is really associated with a range of negative effects, and a lot of people are really suffering from it. And at the same time, are saying that we can use the plant in a certain way to just try to help some people or enhance some treatments, even in psychiatry. That's a possibility. So this is a really complex relationship. And this is also, I think, related to the fact that the individual susceptibility to developing a psychiatric disorder or side effects after cannabis exposure is highly variable among people. So it can be really different from person to person. Okay. And some patients, for example, they experience a lot of anxiety after using cannabis, and other people may experience relief. And that's possibly related to individual sensitivity, of course, but also to the fact that cannabis, as I said, is a really complex plant, right? It's not one medicine; it's probably a combination of several medicines, depending on the combinations of THC, CBD, or having one alone, or how of different doses for different time. They may have also different effects in people. So that's something to take into consideration. And a lot of my colleagues, they don't know that much about it. And also, I have to say, in my modest situation here, I also do not know that much about that. So it seems that I know a lot, but that's not the case, because the knowledge that we have is really basic until now. So we do need much more research to increase our knowledge. And what I notice as well is that you have this kind of social pressure, right? Because a lot of people are saying, we need cannabis is good, and it seems that cannabis might be good for all things. But I do not think so. I think that some individuals maybe may profit from cannabis, but of course not all people will profit from it. And research is really a bit beside.
That's actually a question you get from Nicola. You kind of answered it already, because Nicola asked two questions. The first one is, what illness can you cure with medicinal cannabis? And which are the best quality to use for psychiatric disease? But I think that's you cannot give a general answer, can you?
No, I can't. So that's what's so interesting. So for cannabis, and cure is a really big word, right? So what cannabis do a lot of time is kind of reduce or ease some symptoms for some individuals, right? And for example, we have, so in psychiatry, once again, there are, so at this moment, no indications for it in psychiatry, but we have some evidence coming up that it might be or maybe helpful some individuals with anxiety, maybe with PTSD. For example, CBD, cannabidiol, is also being studied in psychosis. So once again, cannabidiol, not THC. THC is clearly related with an increased risk of psychosis. There are no doubts about this anymore. So these are indications that are being studied and much more. But at this time, we do not have enough evidence yet to say, yes, if you use cannabis, you will get cured, or your symptoms would certainly get better if you have PTSD or if you have anxiety. That's not the case, because we do not know a lot of things. It's what I mentioned is, for example, we do not know which doses we have to use, for how much time we have to use it, what are the consequences of using this for a long time. So this kinds of thing, we don't really know it. And that's something that I also face in my clinical practice, because I'm, for example, just to give you an example and finish, I have a patient, I'm prescribing medical cannabis for a reason. I'm not going to go into the details, of course, but now I've come to the point that I don't know what I have to do next, because I'm doing this for 6 months, and then how long have we treat someone with medical cannabis is something that has to go for years, is something that we have to do for a couple of months. So we do not have information about this, and these are really, really important questions. And there is also a call to all scientists and all people using cannabis off-label to, try to go together and learn from our experience, just to see if we can use this to help people in the future with the data that we are generating right now.
Yeah, I can imagine these are very detailed questions to answer now, because Nicola just put in the chat. He says, I'm a GP from Italy, and he's starting to prescribe cannabis for people with anxious disease and also depression. Well, I don't think this is the place to discuss patients, but would you be available for Nicola in this case to
Sure.
talk on in private? So maybe we can.
Sure, just yeah, of course. Yeah, otherwise just provide her with my email, and I'll be happy to answer the questions, and also it's no problem. Yeah.
We are actually over time, but if you like, I do have some questions still in the question and answer. Would you be able to answer some more? So we'll go.
Yeah, of course. Yeah, I have the time. Let's see. Yeah, I have until 1, so I'm happy to answer.
No, we don't want to take it too long, because it needs to. But then we can at least do the questions that are left now, and Nicola will make sure to get the contact details between you to get some information. That's also the same question again, this time from Linda. In what long-term chronic illness would you recommend medicinal cannabis? Can you recommend medicinal cannabis for any illness?
That's a really good question. I'll try to be short, providing an answer regarding the evidence that we have at this moment. Once again, that's something that, because you said that this is being recorded, right? So probably someone watching to this video a couple of years later, they will say, "Oh, what is he saying?" It's not the case anymore, because right now what I can say is that we have substantial evidence that cannabis, of medicinal cannabis, might help people with chronic pain in adults. So that's something that we know. It's also being used as antiemetic in people in treatment with chemotherapy because of nausea and vomiting. That's also something that cannabis, it seems to be, or have substantial evidence that it works. We do also have an indication, if I do not get wrong, I think it's true for the for multiple sclerosis, for the spasticity related to multiple sclerosis. And if I'm not wrong, I think in 2018, CBD has been approved by the FDA for certain form of epilepsy. So these are the indications where we know that there is substantial evidence, I would say, that cannabis, medicinal cannabis, is working. So these are the indications. For all the other indications, including all psychiatric illness and all other medical illness, the evidence is pretty limited. But once again, that does not mean that maybe in the future there will be more indications. But at this point, the best evidence that we have is for pain, for antiemetics, and for spasticity, for multiple sclerosis, and for certain cases for epilepsy. But that's related to CBD particularly. So this is what I think the indications at this moment. All the rest, the evidence is pretty low. Yes.
Yeah. And it's a very specific question from, I hope I pronounced it right, Orestes Spirou. Can CBD oil in high concentrations treat Parkinson's disease hallucinations if they are caused by a high dose of dopamine-related medicine? Or is that?
Yeah, that's a good. I think it's a nice question asking about the antipsychotic effects of CBD. In this case, high CBD doses. Well, in this case, in the context of Parkinson's disease, but CBD, there's the compound CBD, once again, not medicinal cannabis, but CBD as compound is being studied as antipsychotic because there is preliminary evidence, once again, not yet enough, that shows that CBD may act as antipsychotic. So that's something interesting that we are also looking into it. So that's a possibility that in the future, maybe for Parkinson's disease or for other disorders where psychotic symptoms may appear, CBD might be a possibility. This said, we have to be really careful here because a lot of people will know that you can buy a lot of CBD products over the counter. And here I have to say a couple of important things. So the first one is that these over-the-counter products do not always have only CBD, so that's a bit dangerous. It might happen that these compounds of these products sometimes also contain THC, and this is really clear pro-psychotic. So you get psychotic symptoms from it, right? So you have to be aware of it. And the same holds for those trying to use medicinal cannabis with high concentration of CBD, because even though you are using cannabis with high concentrations of CBD, this cannabis still contains THC. And it is not clear if CBD is able to counter or to compensate the effects of THC. That is not clear at all, if that's the case. So I would always recommend use cannabis, well, not use cannabis, of course, in the first time, but if you're going to do it, use as less THC as possible, because we know that if you use products with THC, you may have more chances of negative effects. And that is for addiction the case, for psychosis, for cognitive problems, etc. So, and regarding the CBD, once again, really limited evidence. It is possible that in the future CBD gets approved for psychosis. It might be a possibility, but not at this moment.
Okay. And now we really are running out of time. The last question I want to do is so I think you touched upon it in the beginning already. So if medicinal cannabis is not approved or there's no evidence for anxiety and depression, are you, in what circumstance are you allowed as a doctor, or would you consider prescribing it anyway?
That's a good point. I would consider this once again as off-label treatment. So that's kind of last resort treatment. That is what the law also allow us. As a doctor, you are allowed to use some medication that is not registered yet with a certain indication. Of course, it has to be medication that you can prescribe, right? As cannabis in the Netherlands can be prescribed. So that's the first step. But the second step, you can, as a doctor, you are able to prescribe a medication off-label if you have grounded evidence. There are some evidence showing that it might be possible that this person may benefit from it, and all the other treatments have already been tried and failed. Then you can, of course, think about using medicinal cannabis as off-label indication. And this said, once again, if you are doing this, what it's also really important is not just giving a prescription and that's it. You have to be really careful with it, because prescribing a drug, whatever the reason for a certain symptom, is also the duty of the doctor to monitor the effect, to monitor the side effects, to think really good about which doses are you going to use, for how much time are you going to do this. And of course, the dose, you have to use the lowest dose that is effective, not the maximal dose, but the lowest dose that is effective. You have to check if there are signs of addiction, that kind of thing. So you have to do this as well. So it's not only about providing the medication, that's it, but you have to monitor this. And in the case that the medication does not work, what sometimes happens, then you have to stop the treatment. That's also really important to avoid, starting things and never stopping them. That happens a lot in medicine in general.
Even before, so there are a lot of checks you need to do before you can prescribe it, but then you're not off the hook. As a doctor, you need to control
Exactly.
and follow the patient.
Exactly.
That was the final question. Also, again, we're running a little bit out of time. Thank you very much, Albert. If people like Nicola want to get in touch with you or learn more about your outpatient clinic, where can we find that information?
Yeah, we have a website at the University Utrecht. We have a website there with information about our polyclinic and also the way that you can be referred to us. So that would be, I think, the best way to find me. And of course, if someone has,
if anyone Googles your name, they'll find the outpatient clinic in Utrecht.
Yeah, that for sure. And if there's someone really interested and wants to mail me, I mean, all of you have also my email, so you can just give it to specific persons who have certain questions for me. It's also totally fine.
It's good to know. So people that they can contact Bedrocan all the time, of course, and they can also contact the University Utrecht if they want to get in contact with you. Well, Albert, thank you very much for your time and for your very interesting story. We will, I hope to speak to you, keep speaking to you in the coming period to see how the outpatient clinic actually is developing. And I hope with you and that in the end you can close your clinic again, because the work that you're doing right now is being done by every doctor in the Netherlands, at least.
That would be great.
Thank you very much. And to the audience, I'd like to say you can this webinar will also be posted on YouTube, so it will stay available if you'd like to check something. And please keep track of the next episode. We will announce it shortly. Thank you, Albert. Thank you, people at home. See you next time.
Bye. Thanks.
Bye-bye.